Good afternoon. So please introduce yourself and your company.
My name is Mark Carrozza. I'm with HealthLandscape LLC. We are a collaborative of the Health Foundation of Greater Cincinnati and the Robert Graham Center here in Washington, D.C.
And how can we find you online?
We are at www.healthlandscape.org.
Great. And could you describe your product or service briefly?
Sure. We're a web-based mapping application that lets you visualize health data. We have a large library of health data, economic data, demographic data, crime data that we have been acquiring over the last 7-8 years from state, national, local resources.
And how would someone use this data? Who would be your key customer?
Well, key customers, we have several key customers. What we're talking about today is our new Community Indicators data portal. And it's really designed for organizations, for groups of organizations in metro areas or regions. A classic example is where you have a United Way and a Chamber of Commerce and a community foundation who are all trying to make collective impact in a region. And whenever you're doing that, it's always important to have some degree of shared measure so that everybody's measuring infant mortality the same way. Everyone's tracking alcohol sales the same way. And when you don't have a tool like the Community Data Portal, you have 5, 6, 7, 8 different community reports, and you're sitting in a community meeting and someone will say, what is our infant mortality rate? What is the impact of domestic violence in the region? And the typical answer is, well, it depends on whose report you're reading. Well, what we're doing with our Community Data Portal is creating a portal for shared measurement across multiple organizations to eliminate duplicated reports, reduce duplicated effort, and make it easier to have shared impact in the region.
So the data is provided by local organizations or identified by local organizations?
It's identified, then it's a mix. I mean, we've got a big data library that we maintain that has state level, that has data from states, from federal organizations, and then the organization can bring the organizations can bring in their own data. So they may bring in data that's from local community surveys. It could be data from local hospital systems. It could be anything that they have in their data systems and that we have in our data systems.
Great. And what's your revenue model?
Well, for the www.healthlandscape.org site, it's a pure subscription model, software as a service, where you can come in and upload your own data on an individual basis. If you're an organization from a metro area or a large city, and you've got a group of organizations that want to use the portal, then it's a tiered subscription model where we look at basically the size of your organizations and the sources of revenues. For us, the United Way of Los Angeles is completely different than the United Way of Huntington, West Virginia. And the pricing model is just not going to be the same.
Right.
Not going to do that to West Virginia.
So based on those sources of data that you're using in order to make this work and the software as a service, is this something you could have done a year ago, 5 years ago, 10 years ago, or is this something that's sort of up to the minute?
It's always up to the minute. It's always changing. 20 years ago, if you wanted to use this data, you were dealing with round-reel tapes or maybe 30, 40 cartridges or CDs. Things have changed a lot.
Right. And more recently?
More recently, with the APIs that are coming out, with the direct access to data from Carrozza, from HHS, from CDC, it's much easier to build these tools, to design these tools, to make the data available. What we like to do is we talk about trying to eliminate the gap between the data producers and the data users. So between their data dissemination strategies and our tools, we're really reducing that gap.
Great. Thank you very much.
Okay, thanks.